Good afternoon, friends. I'm Dr. Aajay Shah, and I'm starting this regular posting on our YouTube channel, Healthy Living with Dr. Aajay Shah. So please subscribe to this channel if you have not subscribed so you can get our regular videos. The videos will be all on about healthy lifestyle, about physical health, mental health, spiritual health. Even we will be including some of the other type of health, including financial health, career health, relationship health, family health, longevity. We'll be talking about all those topics, how to be a very successful person, not just in terms of physical health, but in every aspect of our life. So please subscribe to our channel. We are also on Facebook, so please like our Facebook page, Healthy Living with Dr. Aajay Shah. Invite your friends and invite your family members to our Facebook page, to our YouTube channel, and obviously share this video if you think it will be useful to your friends and family. Thank you. So today, this afternoon, I'm going to bring a topic which is a very, very important topic this days and age, and it's about Alzheimer disease. Alzheimer disease. So my upfront point to you is that if you follow this Alzheimer YouTube talk on our channel, there will be about 30 segments. Today I'll be recording segment number 1 with 30 segments, and if you follow this 30 segments, if you listen to each one of them, you can prevent the Alzheimer disease by 90%. So 90% chance you will not get Alzheimer disease if you follow what I'm going to teach you in this 30 segments on Alzheimer disease. Each segment will be about 10 minutes long. If you or someone has Alzheimer disease, you can actually stop it progressing, and actually you can reverse it. Worldwide, there are 47 million people have Alzheimer disease. In America, there are about 6 million people in 2016, and now probably there are about 7 to 8 million people in America. So very, very high prevalence of Alzheimer disease. Most chronic disease, including heart disease, diabetes, cancer, the death rate has been declining, but Alzheimer disease, the death rate has been actually going up. Like again, I said, 90% of Alzheimer disease can be prevented, and remaining 10% where it cannot be prevented, it can be delayed by 10 to 15 years. So even if you have that unfortunate gene, which we'll talk about it for Alzheimer disease, even in those people with both allele having 2 copy of the genes from your parents, you can even delay the disease by 10 to 15%. So definitely very useful information we'll be recording in this segment 1 to 30. Today is a segment 1. Again, the prevention and reversal of Alzheimer disease has to be very comprehensive. It's just not a one thing you do, but it has to be a multiple things you do with your lifestyle. Again, Alzheimer disease can be reversed, can be prevented, and can be stopped progressing for sure. So again, there are various things which we'll be talking over next 30 segments of what prevents and reverses Alzheimer disease. The most important is what we eat. We'll be talking about what type of food we should be eating. Typically, it will be whole food, plant-based diet with no oil. What kind of body weight we should be maintaining. We'll talk about body mass index. It should be below 25, preferably below 22. If you have not measured out your body mass index, use an online calculator and measure out body mass index. We'll be talking more about body mass index. Also, importance of exercise. We'll talk more about exercise. Importance of sleep. Importance of meditation, importance of sunlight, importance of diagnosing and preventing and treating depression, importance of relationship, importance of stress management, importance of substance abuse, including not having too much alcohol or any other drugs or smoking, importance of engagement with other people, and importance of having purpose in life. All those things, if done in an optimal way, will prevent and will reverse the Alzheimer disease. And if Alzheimer disease is already happening, it will stop it progressing. So again, all those factors, all those features, we will cover over next 30 segments. Actually, people fear about Alzheimer disease as much, if not more, than a cancer. Many people say the cancer can be sometimes treated well, but people think that Alzheimer's disease cannot be treated. It's a progressive disease. It's almost like a death sentence, and people are more feared of Alzheimer's disease. People definitely are more feared about Alzheimer's disease than heart disease. Alzheimer's disease actually also has a concern because the caregivers, the kids, the spouse sometimes have a high amount of burnout. A matter of fact, spouse of Alzheimer's person has a 6 times higher risk of developing Alzheimer's disease because many of the lifestyle are shared by the two spouses. So if one spouse develops Alzheimer's disease, other spouse has a 600% or 6 times more chance of developing Alzheimer's disease. Uh, 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 in uh, in 2027, there will be 10% of people above 65 who will have dementia or Alzheimer's disease, and 50% of people above age 85 will have Alzheimer's disease or dementia. So again, after age 85, Alzheimer's disease is very common, and in next 10 years, 1 in 2 above 85 will have Alzheimer's disease. We all probably going to live up to 85 in 10 years. So I think we all have a very, very high chance of developing Alzheimer's disease. Every family will be affected, spouse will be affected, kids will be affected, friends will be affected. And there will be a very large burden on many offsprings in terms of taking care of parents. In 2016, Alzheimer's disease was a sixth leading cause, but actually it's underreported. So probably third leading cause of death in America. The cost of Alzheimer's disease is also very high. $226 billion of the cost to USA, very expensive disease. If you put all the cost of hours family put into taking care of a patient with Alzheimer, the cost is even higher. And there's a projection by 2040, 1 trillion will be the cost of Alzheimer's disease. So very, very expensive disease. If obesity and diabetes gets more prevalent, there will be higher and higher prevalence of Alzheimer's disease. We'll talk about it. What are the risk factors for developing Alzheimer's disease and dementia? In the past, many doctors, many neurologists, many scientists thought that Alzheimer's disease is a progressive, irreversible disease. But now, with the newer data, with the newer science, we know that Alzheimer's disease can be reversed, can be prevented, and can be stopped from progressing. Like I said, 6 million Americans, probably 7 million Americans now have Alzheimer's disease. So again, prevention of Alzheimer, reversal of Alzheimer, and stopping the progression of Alzheimer includes many factors which I already talked about it. It's worth repeating. Those are role of nutrition, exercise, stress management, sleep, and active brain stimulation, including brain puzzles, reading actively, having a hobby where you have to use your brain. We will cover each of these topics and each of these factors as we go in our segments. Again, this is segment 1 of segment 30. Definitely our diet has played a large role. Eating high sugar diet with a lot of simple carb, a lot of saturated fat has played a major role in development of Alzheimer's disease and dementia. Definitely sedentary lifestyle has played a role. We all need to be more active. We know only 25% of Americans get recommended physical activity of 150 minutes per week. So 75% of Americans don't get enough physical activity. Definitely, early stages of Alzheimer can be reversed. We'll talk about that. We'll also talk about high blood pressure, diabetes, high cholesterol, how they can affect the prevalence of Alzheimer's disease, and how those factors can make you more prone to have Alzheimer's disease. Like I said, a spouse of an Alzheimer person has a 600 times or 6 times higher chances of developing Alzheimer's disease. So again, how can you do that? Number 1, change your lifestyle, which we will talk about it. Find a physician who has an interest in lifestyle changes, or find a physician who is board certified into lifestyle medicine. I'm board certified into lifestyle medicine. If you live in Michigan, you can reach out to me. I can provide you a phone consultation. Typically, insurance covers it. So I definitely can guide you on changing the healthy lifestyle. That can prevent Alzheimer's disease. That can also do many lifestyle benefits, including prevention and reversal of diabetes, prevention and reversal of high blood pressure, obesity, even cancer. Now, if you want to look it up for the lifestyle physician who is board certified, you can go to American College of Lifestyle Medicine and see who is board certified into lifestyle medicine. Uh, Most doctors think that lifestyle changes do not work. I'm exactly opposite of that. I essentially think the lifestyle changes work for sure. I have multiple hundreds and thousands of patients when they have changed lifestyle, they actually are doing great. They are getting off their medications. They're getting off their insulin. They're reversing their Alzheimer's disease. They are preventing Alzheimer's disease. I have actually a patient right now who's diabetic who has cut down the insulin from 200 units to only 60 units in just 13 days. So that can be done. There's a lot of assumptions on doctor side and medical community side that patients or people typically will not change, are not willing to change. In my opinion, that's a wrong assumption. I sincerely believe that with proper coaching, with proper education, with proper hand-holding, with proper compassion, with proper care, you can definitely reverse and prevent Alzheimer's disease and many other chronic diseases, including diabetes, high blood pressure, obesity, heart disease, and cancer. I've done it consistently. I actually take pride in having many of my patients be able to reverse many of the chronic disease. For example, we have a community in Loma Linda, California, Seventh-day Adventist community right here in America, where many of them are vegan, many of them exercise regularly, they don't smoke, they don't drink alcohol, they don't even drink coffee. They have very good family connections, they move every hour, they're very religious, very spiritual, and in that community, Seventh-day Adventist, chances of Alzheimer's disease is very low. Almost, I believe, if I remember the numbers, it's almost like 1/10 of an average American, and they live 10 years longer than an average American. So if Seventh-day Adventist community can do it, I'm sure definitely we can do it too. They live right here in America. They have same kind of stress. They have same kind of healthcare system. They have same kind of doctors. So if they can do it, we definitely can do it. It will definitely require lifestyle change, and I always say lifestyle change with a thought in mind. And I got this way of saying from my good friend Steven Sharma, a thought in mind. It starts with a thought of changing the lifestyle. Thought leads to action. Action leads to habits. Habits leads to lifestyle, and eventually lifestyle leads to destiny. So if you start with a thought that you want to prevent and you want to reverse the Alzheimer's disease, that thought eventually will lead to your destiny. And I will definitely help you all the way up to you succeed in achieving that goal. So definitely listen to my talk on YouTube on Healthy Pillars. It's about hour-long talk. Definitely listen to that talk. Subscribe to our channel. Matter of fact, listen to all our talks as you have time. Definitely listen to my diabetes talk. It's one of the most comprehensive talk if you have type 2 diabetes. Listen to my stress reduction talk because stress plays a large role in many of the mental disorders. So listen to that talk. And I can definitely show you on our Facebook page how you can have a personalized program. So subscribe to our YouTube channel, share with your friends and family, like our Facebook page, invite your friends and family to our Facebook page, and let's work together. Let's change our lifestyle as much as we need to. Let's get healthier, let's get happier, and let's live long. Thank you.